Welcome to the Senior Health video. This video will talk about early heart attack symptoms that can strike when you're alone. Have you ever stopped to imagine what it would feel like if your heart suddenly turned against you and no one was there to help? It is a thought that few people allow themselves to face, yet it happens to thousands of Americans every single day. A man might be sitting in his living room watching the news when a strange heaviness fills his chest. A woman might wake up in the stillness of the night with pain creeping up her left arm. Both pause, hoping it will fade, telling themselves it is probably nothing serious. But within minutes, the body begins to sweat, breathing becomes harder, and a quiet panic takes hold. A heart attack does not always shout. Often it whispers through discomfort, fatigue, or nausea, and when it happens while you are alone, those whispers can quickly turn fatal. Every second counts as blood flow to the heart becomes blocked and oxygen disappears. Most people lose precious time waiting confused by the symptoms until it is too late. The truth is that half of all heart attack deaths occur within the first hour, long before reaching a hospital, but there is hope. There are precise, science-based actions you can take to survive even when no one is around. These are simple, powerful steps that can keep your heart beating until help arrives. Knowledge is not just protection, it is power. In this guide, you will learn the 7 early warning signs that reveal when your heart's in danger, and the exact steps to take if a heart attack strikes while you are alone. This is not just information, it is preparation for the most critical moment of your life. Stay focused, stay calm, and let this knowledge be the reason you survive. Number 1, cold sweating and sudden paleness. It often begins quietly. You might feel a strange chill running through your skin while the room around you feels perfectly normal. Then you notice your palms turning cold and clammy, your shirt damp even though you have not moved. This is not ordinary sweat. It is your body's alarm system screaming for help. When the heart struggles to pump blood, the body releases a surge of adrenaline, forcing the blood vessels to tighten. That reaction makes you pale and drenched in cold sweat as your heart fights to survive. Doctors warn that this early sign is one of the most overlooked in America. People often mistake it for anxiety or exhaustion, but studies from the American Heart Association show that sudden, unexplained sweating can appear up to 10 minutes before severe chest pain. Recognizing it could buy you the time needed to act. If this happens, stop immediately, sit down and breathe slowly. Call for help even if you are unsure, because your body never sweats like this without a reason. A man once described how he ignored that cold sweat before collapsing in his kitchen. Luckily, his neighbor found him in time and saved his life. But knowing this sign alone is not enough, because another warning can be even more deceptive and far more dangerous. Number 2, nausea and unexpected vomiting. Right after that wave of cold sweat, another strange signal can appear, one that most people never associate with their heart. You start feeling sick to your stomach for no reason. The nausea builds slowly, maybe after dinner or while resting, and before you know it, your body is fighting the urge to vomit. Many people think it is just bad food or stress, but in reality, this could be your heart begging for help. When the heart's blood flow becomes blocked, it can irritate the vagus nerve, the same nerve that controls your stomach. That irritation creates nausea and even vomiting during the early phase of a heart attack. Research from Johns Hopkins University confirms that women in particular often experience nausea as one of their first heart attack symptoms. They may never feel chest pain at all. For seniors with diabetes, this warning can be even more silent because nerve damage can dull the usual pain. The solution is awareness. If nausea appears suddenly with cold sweat or lightheadedness, do not dismiss it. Sit down, stay calm, and call emergency services immediately. A retired teacher once shared that she felt sick for hours before realizing she was having a heart attack. Her quick call for help saved her life. But just knowing about nausea is still not enough, because the next signal can strike even faster and cause your world to spin out of control. Number 3, dizziness and feeling faint. Right after nausea strikes, another danger can come without warning. The room starts spinning, your vision blurs, and your legs feel weak. You grab a chair or the wall for support, hoping the feeling will pass, but it only grows stronger. This is not simple dizziness. It is your brain signaling that your heart is not sending enough blood and oxygen. When the heart struggles to pump properly, blood pressure drops sharply, and the brain becomes starved of oxygen. That is why so many heart attack victims describe a sudden wave of lightheadedness or the sense that they might faint. Harvard Medical School researchers report that up to 1 in 5 heart attack patients experience dizziness before any chest pain appears. It often strikes older adults and women first. Many ignore it, thinking it is dehydration or fatigue, but that delay can be fatal. If you ever feel faint while sweating or nauseated, stop immediately. Sit down, keep your head slightly elevated, and call for help. Never try to stand or walk it off. A woman from Florida once fainted while gardening on a warm afternoon. She woke up in the hospital after doctors confirmed she had survived a heart attack. Her story proves that dizziness should never be taken lightly, but only recognizing the symptom is not enough because the next warning hides in a place most people would never expect. Number 4, numbness or heaviness in the arm. After dizziness, another clue often appears in a place people least expect. A strange heaviness creeps into your arm, a dull ache that feels as if someone placed a weight on it. Sometimes it is the left arm, but it can also strike the right or even both. This is not muscle pain. It is a signal from your heart. When the heart lacks oxygen, the nerves that share pathways with the arm become confused, sending pain and numbness to the wrong place. That is why people often describe arm discomfort even when the real problem lies in the chest. Cardiologists from the Mayo Clinic explain that arm pain related to a heart attack often starts subtly like tightness or tingling and gradually builds to intense pressure. It may travel to the shoulder, neck, or back. Many mistake it for joint stiffness or fatigue from daily work, losing precious minutes before seeking help. The solution is simple awareness. If your arm suddenly feels heavy tingling or oddly weak, especially with chest pressure or shortness of breath, stop what you're doing, sit still, and call for medical help. The earlier you respond, the greater your chance of survival. A retired engineer once felt his left arm grow numb while fixing a light bulb. He ignored it until the pain reached his jaw. Doctors told him that those 10 lost minutes nearly cost him his life. But knowing how pain travels is still not enough because the next symptom can take your breath away before you even understand what is happening. Number 5, shortness of breath and chest tightness. Right after that strange arm heaviness, something far more frightening can take over. You suddenly cannot catch your breath. The air feels thin, even though the room is full of it. You try to inhale deeper, but your chest feels tight as if an invisible hand is pressing down with force. This is your heart's desperate cry for oxygen. When a blockage forms in a coronary artery, blood flow to the lungs, and heart becomes restricted, and your breathing instantly reflects that struggle. According to the American Heart Association, more than 40% of people experience shortness of breath before any chest pain. It can appear while walking, lying in bed, or doing something simple like bending to tie your shoes. Many dismiss it as fatigue or aging, but in that hesitation, the heart grows weaker. If you feel breathless without reason, stop moving, sit upright, and focus on calm, steady breathing. Call for medical help immediately because waiting even 5 minutes could cost your life. A woman from California once said she thought her shortness of breath was caused by anxiety. She drank water and tried to rest, but minutes later collapsed. Paramedics arrived just in time to save her. Her story is a reminder that your breath is the first sign of your heart's strength. But knowing this warning is still not enough, because the next symptom hides behind something you would never link to your heart at all. Number 6, intense anxiety and a sudden sense of doom. Just when the shortness of breath begins to fade, something far more unsettling can rise within you. An overwhelming wave of fear floods your mind. It feels like panic, but deeper, heavier, and unexplainable. This is not just anxiety. It is your body's survival alarm screaming that your heart is in danger. During a heart attack, the body releases massive amounts of adrenaline. That chemical storm triggers the same response seen in panic attacks. But this time, the cause is not emotional. It is physical. Cardiology experts from the Cleveland Clinic note that patients often describe a powerful sense that something terrible is about to happen moments before chest pain begins. They feel restless, uneasy, and trapped in a feeling they cannot shake. Some even call it the sense of doom. The mistake most people make is assuming it is stress or fatigue. The truth is that the heart and brain are deeply connected, and your emotions can sometimes warn you faster than pain can. If you ever feel sudden intense fear or panic without clear reason, pause, immediately breathe slowly and call for help. It is far better to be cautious than silent. A retired nurse has once said she nearly ignored her sudden wave of panic, thinking it was just anxiety. Minutes later, she collapsed from a heart attack. Her instinct almost saved her before her body gave out. But even this strong emotional signal is only part of the story, because the next symptom is the most visible and the most dangerous one of all. Number 7, crushing chest pain and pressure. And then comes the signal no one can afford to ignore. A deep, crushing pain erupts in the center of your chest, pressing so hard it feels as if an elephant is sitting on you. You try to move, but the pain grows stronger, spreading to your jaw, neck, or back. This is the classic and most dangerous warning of a heart attack. It happens when blood flow to the heart muscle is suddenly blocked, starving it of oxygen. The heart tissue begins to die, and every second becomes critical. According to the American College of Cardiology, chest pain remains the leading symptom in more than 70% of heart attack cases. Yet millions still wait, hoping it will fade, thinking it might be heartburn or stress. That hesitation can be fatal. The right response is immediate action. If you ever feel this type of pressure, stop everything, sit still, and call emergency services. Do not try to drive. Do not wait it out. Early medical treatment can open the blocked artery and save your heart muscle. One man from Texas shared that he ignored his chest pain for 20 minutes, believing it was indigestion. By the time he reached the hospital, doctors told him he had lost part of his heart function forever. But recognizing pain alone is not enough, because what truly saves lives is knowing exactly what to do when it strikes and you are completely alone. You have now learned how the body warns you before disaster strikes, but awareness is only half the battle. The real test begins when those symptoms appear and you are all alone. What you do in the next few minutes can decide everything. In this next part, you will discover the life-saving steps to take when a heart attack hits and no one is there to help. Number 1, the first step when a heart attack strikes. When a heart attack begins, every second becomes a race against time. The very first thing you must do is call 911 immediately. Do not hesitate, do not wait to see if the pain will fade, and never try to drive yourself to the hospital. During a heart attack, blood flow to your heart is blocked. Blood pressure can drop sharply, and dangerous arrhythmias can cause sudden loss of consciousness. Behind the wheel, that moment could be fatal, not only for you, but for others on the road. Studies from the National Heart, Lung, and Blood Institute confirm that over half of heart attack deaths occur within the first hour. Many of these lives could have been saved by a simple phone call. If the ambulance takes longer than 15 minutes, contact a taxi, an Uber, or a neighbor for help. Time is your strongest weapon. The earlier you receive medical attention, the more heart muscle can be saved. Stay calm, keep your phone close, and tell the dispatcher exactly what is happening. Follow their instructions while sitting still and breathing slowly. Remember, every minute of hesitation allows more damage to your heart. Quick action saves lives, and yours could be one of them. But knowing when to call is only the beginning, because what happens while you wait can be just as critical. Number 2, why you should never drive yourself to the hospital. After calling for help, one of the most dangerous mistakes people make is deciding to drive themselves to the hospital. It feels logical in the heat of the moment, but it can turn deadly in seconds. During a heart attack, blood flow to the heart muscle is blocked, oxygen levels fall, and blood pressure can crash without warning. This combination can cause fainting or cardiac arrest while driving. Losing consciousness behind the wheel does not just endanger you, it puts everyone around you at risk. Research from the American Heart Journal shows that nearly 1/3 of patients who tried to drive during a heart attack never made it to the emergency room. The physical effort of steering, braking, and concentrating forces the heart to work harder when it is already starved of oxygen. Even a few minutes of added stress can worsen the damage. The smarter choice is to wait for emergency responders or ask someone nearby to take you. Stay seated, stay calm, and keep your phone close in case dispatchers need to reach you. A woman from Chicago once drove herself after feeling chest pressure. She lost consciousness at an intersection. Luckily, a bystander called 911 and saved her life. But avoiding the driver's seat is only part of survival, because the next few minutes while you wait can decide how much of your heart you save. Number 3, what to do while waiting for help to arrive. Once you have called for help and avoided driving, the next few minutes become a test of control and awareness. What you do while waiting can determine how much of your heart survives. The first step is to create a safe environment. Unlock your doors so emergency responders can reach you, easily clear the space around you, and keep pets in another room. Then focus on your breathing. Panic makes the heart work harder, increasing oxygen demand and worsening damage. Take slow, deep breaths, stay seated, and lean slightly back to reduce strain on your chest. Cardiologists from the American Heart Association emphasize that calmness saves lives. Every time you panic, your body releases adrenaline, which raises your pulse and blood pressure. By staying still and breathing steadily, you give your heart a fighting chance. Keep your phone beside you in case dispatchers call back, and if you begin to sweat heavily, use a cool cloth on your forehead to stay steady. A man from Denver once recognized his heart attack early and stayed seated while waiting for paramedics. Doctors later said his calm behavior saved part of his heart muscle. But staying calm is only part of survival because there is one small action you can take next that could save your life before help even arrives. Number 4, the power of aspirin and how to take it correctly. After you have made yourself safe and calm, there is one small but powerful step that can dramatically increase your chance of survival. If you have aspirin nearby, chew it immediately. Do not swallow it whole. Chewing allows the medicine to enter your bloodstream faster, helping prevent the clot that blocks blood flow to your heart. This simple action can slow the damage until medical help arrives. Research from the American College of Cardiology shows that taking aspirin at the first sign of a heart attack can reduce the risk of death by nearly 20%. Aspirin works by preventing platelets in your blood from clumping together, reducing the size of the blockage that starves your heart of oxygen. Use low-dose aspirin around 81 to 100 milligrams, and only take it if you are not allergic or told otherwise by your doctor. Wash it down with a sip of water if needed, but do not delay. Every minute the clot remains, more heart cells die. One man from Ohio survived because he remembered to chew his aspirin while waiting for paramedics. Doctors later told him that single decision saved 1/3 of his heart function. But taking aspirin correctly is only one step, because the next common belief many people trust during a heart attack could be far more dangerous than they realize. Number 5, the truth about coughing during a heart attack. After learning the right way to use aspirin, it is time to clear up one of the most dangerous myths still spreading online. You may have heard that coughing hard during a heart attack can save your life. It sounds believable because coughing feels like it might restart your heart, but this idea is completely false and potentially deadly. During a heart attack, your heart is still beating, though irregularly and under extreme stress. What it needs is oxygen and emergency care, not physical strain. Studies reviewed by the American Heart Association confirm that cough CPR does not work and can actually make things worse. Coughing raises chest pressure and forces your heart to use more oxygen at the very moment it is running out. The truth is that cardiopulmonary resuscitation, or CPR, is only needed when the heart is completely stopped and the person is unconscious. If you are awake, coughing wastes precious energy. The correct response is to stay calm, chew aspirin if available, and wait for help to arrive. A man from New York once tried to follow an online video that told him to cough through his chest pain. He collapsed minutes later. Doctors said those wasted seconds nearly cost him his life. But knowing what not to do is only part of survival, because another common mistake involves a drug people often take without realizing the deadly risk. Number 6, the hidden danger of taking Vasodilator pills without guidance. After clearing up the coughing myth, there is another silent mistake that many people make in panic. They reach for vasodilator pills like isosorbide or nitroglycerin, thinking it will ease the pain. But taking these drugs during a heart attack without medical supervision can be extremely dangerous. Vasodilators work by relaxing blood vessels and lowering blood pressure. In a heart already struggling to pump blood, that sudden drop can cause fainting, collapse, or even death within minutes. Cardiologists at the Mayo Clinic warn that combining vasodilators with medications for erectile dysfunction, such as Viagra or Cialis, can trigger a severe blood pressure crash. This combination deprives the heart and brain of oxygen and can lead to cardiac arrest. Some people with a type of heart attack that affects the right ventricle are at even higher risk because their heart depends on stable pressure to function. The safest move is always to wait for emergency responders. They can measure your blood pressure and decide if medication is appropriate. A man from California once took a vasodilator as soon as the pain began. His blood pressure dropped instantly and paramedics barely saved him. Doctors said his self-medication nearly cost his life. But understanding what not to take is just one side of the story, because true recovery begins with how you protect your heart after the crisis ends. You have now learned the warning signs that your body uses to cry for help, and the exact steps to take when a heart attack strikes while you are alone. Knowledge is the most powerful medicine you can carry. It can turn fear into calm, confusion into control, and panic into survival. Every action you take in those first few minutes matters. Call for help, stay calm, chew aspirin if available, and avoid risky self-medication. These simple steps can save your life or the life of someone you love. Remember, your heart is not your enemy. It is the engine that keeps your life moving. Treat it with care, nourish it with healthy foods, stay active, and manage your stress. Even small lifestyle changes can repair years of damage when done with consistency and love for yourself. If you have already survived a heart scare, see it not as a warning, but as a second chance. The next heartbeat is an opportunity to begin again. In our next video, we will uncover how certain everyday foods can either protect your heart or silently harm it, and how you can build a daily routine that keeps your blood flowing strong. So do not leave without saving this video and subscribing to our channel. Turn on the notification bell to receive the latest health advice, nutrition tips, and senior care insights. Stay with us, take charge of your health, and remember that every choice you make today shapes the strength of your heart tomorrow. Your future is in your hands, and your next heartbeat begins right now.